So for those of you that are watching outside of the state of Utah, think about this. This is a really good profit center for you to get trained in this, get the JTech, and become that specialist in your area. Good morning, Dr. Shetland here, and I'm here with Dr. Karin Boyer. She is a doctor of physical therapy, and she's actually certified with the Whiplash Group. She's done the advanced training for the doctors, the attorneys, and she is a black belt at using JTech as objective findings to help back up for second opinion exams and for just in her own practice. And I just want to introduce yourself, give us some background on who you are and why you love doing what you do and how you get your training.
I've been a physical therapist for many years, and I've always worked with in the orthopedics field. When I was at Intermountain, I did work injuries, and that's when I started with functional capacity evaluations and found that they're so good at objectifying a patient's symptoms and function. So when I started my own business a couple of years ago, it was easy for me then to transition to continue with the FCEs.
So using what you use when you're doing these exams, what are some of the benefits in helping find objective findings and documentation for especially for the personal injury cases?
So I test the algometry of a patient, so the patient's perceived pain, which is really good to know if a patient have a higher pain threshold or a lower pain threshold. And then I measure passive, active range of motion, strength. It can be static strength and also functional strength. And depending on their injuries, let's say it's a hand injury, we do different testing that are still very much measured, and that has a research background. I like the JTech because it is so evidence-based. They've done several years of research, and it's easy then to see what a patient can do and what it correlates to their injury.
Okay, so when the patient comes in, you're using the JTech technology to do your workup, your exam, and you're gathering objective evidence through proper measurement, through instrument measurements. And I understand JTech also helps once you put all these pieces together. I mean, you physically have to do the exam, but it's calculating inside the software to then create a really nice report to put all the pieces together. Is that correct?
Oh, yes. It makes it so efficient that I do the testing, and then the program comes out with the patient's function and dysfunction, their disability, and it also writes down their research, evidence that's based on where it's coming from.
So it's
It's a
anchoring or
beautiful.
linking the research into the report for the findings that you guys find.
Exactly.
Wow, that's really awesome. So for
Yeah.
you doing this, I mean, people can come to your office and do this, and you're in Salt Lake City. Are you able
Hmm.
to travel and help people in other surrounding
Yes, I
areas?
yeah, I can certainly do that.
So, Doctor, you've designed this where you can have people come to your office, or you can actually travel and take the equipment and the computer and do these tests on site at other doctors' offices in your area. So, Dr. Karen has done a great job, not only building an amazing practice that she has her other specialties in, but to bring in this niche of JTech and helping document objective findings for personal injury cases where you can refer to her or she can come to your offices on site and do these tests for your patients in a certain area. So for those of you that are watching outside of the state of Utah, think about this. This is a really good profit center for you to get trained in this, get the JTech, and become that specialist in your area where people are referring over to you to get this objective finding. So we have multiple doctors with different licenses, MDs, DCs, PTs, on the same cases, but now we're all substantiating with objective findings the need for care and the length of need for care for these patients, which helps give the attorneys the leverage they need to better fight these cases in court or for settlements so the patient gets better restitution and we all get paid fair exchange for our services and we'll get our fees hacked. So thank you, Karen, for doing this for us in the state of Utah. Thank you, thank you. And for those of you outside of state, do this. We need to fill this niche.
Dr. Shetlin, I want to thank you. You've been so helpful for me with the whiplash injury group. You've really advised me a lot. I just want to say thank you for that.
Oh, my pleasure. I love to see us all working together to help,
Hmm.
like we say, the rising tide floats all boats. We all want to help each other out in this. And ultimately, our patients win when we work together like this. So thank you for engaging so well with this. And Karen, how can the doctors here locally that want to refer to you, how can they get a hold of you? Or doctors across the country that are in the Whiplash group that maybe want to learn from you how they can use this model in their state?
They can contact me through my email, flowmobilitypt@gmail.com, or call me on my phone, 801-557-2789.
Thank you
Yeah.
so much for taking the time today for this interview.
Thank you.